Minoxidil is the most Googled hair loss treatment today. Is it worth the hype, or should you consider PRP or GFC instead? That's what we are going to talk in today's show. Let's Talk Aesthetics by Navin Koushik. 8 out of 10 patients who visit us for hair transplant are people who have used minoxidil in the past. Now, when we ask them, why did you use minoxidil? The only answer that we got to hear is, I checked on Google and minoxidil was supposed to be used to control your hair loss. That's what they said. Also, a few of them went to their local doctors to understand what they can do to control their hair loss. Now, they were recommended minoxidil. It's okay. Minoxidil is definitely a maintenance program to control hair loss. Minoxidil is a vasodilator. It increases blood supply to your scalp. It also stimulates your hair follicles and can control hair loss. For many, it works. But what I feel should have been educated to the patients are, once they start using minoxidil, it's not something they can stop as soon as they see a good control in their hair loss. That's not how it works. Once you start minoxidil, you're supposed to be on it continuously for a really long period of time. It could be in years. In comparison to that, when you compare it with PRP as a treatment to control your hair loss, what happens is, a procedure like PRP is done using your own blood, which means it's 100% safe and it can be performed for a very prolonged period of time. Now, what happens in PRP? We draw about 20 ml of your own blood, which is then centrifuged in a machine where it is basically spun at a very high speed. Now, this dilutes your blood. It separates the red blood cells and the white blood cells. What we need is the white blood cells, the rich plasma. Now, as we start injecting this plasma onto your scalp, it creates an availability of nutrition in that region, which means your hair roots can absorb that and grow stronger and healthier. Now, is this a lifelong treatment? We can still say yes to it. Now, how do we advise PRP treatments at Avatarluxe? Is very simple. We ask you to start with 1 session per month and continue it for about 4 to 6 months. Now, during this tenure of 4 to 6 months, you will start noticing your hair loss should have been controlled, and also your thin and weak hair must have thickened again. Now, once you're done with this, what we normally advise is maybe 2 to 4 sessions yearly. Now, the best part of PRP is you don't have to necessarily stick to one specific clinic throughout your lifespan. Now, for example, if you're in Bangalore today, you can always visit Avatarluxe, meet our surgeons and consult them and start with your PRP treatment. However, tomorrow if you are shifting to a different location where we do not have Avatarluxe, you can always visit another doctor and they will be able to perform exactly the same treatment without any concern. Just make sure you visit a plastic surgeon or a board certified dermatologist. Now let's talk about a more newer and most advanced procedure when it comes to hair loss treatments, the GFC. Now think of it like an upgraded version of PRP. The procedure is quite similar to how we perform PRP. The only difference is, in growth factor concentrate, we use specific GFC kits to perform the same procedure. Now what it does is it isolates pure growth factors from your blood. Now, which when injected can not only thicken your thin and weak hair, it can also regrow hair wherever roots are alive. Now, for example, a lot of roots would have attained miniaturization. You might notice some of your hair might have become extremely thin and fragile, just looks like baby hair. Whereas at some point it must have been healthier and thicker. Now, in these cases, GFC will definitely help you to thicken that thin and weak hair. Now, the best part is you require fewer sessions than PRP. For example, if you need about 4 to 6 sessions in PRP, you only need 4 sessions with GFC. Now, with GFC, once you're done with 4 sessions, you might need only 1 or 2 sessions yearly as a maintenance to continue the same result. One of those very successful patients of GFC is myself. In fact, I'm going to show you at what condition I was when I started my GFC back in 2018. Now, if you look at the screen, you will notice I had quite a good amount of thinning. Yes, it did affect my confidence, especially for someone who is from the same industry. When I'm supposed to talk about hair to other people, imagine me not having hair. That was really disturbing. Now GFC did come for the rescue. Not only did it thicken my hair, in fact I have head full of hair today, and the best part, I've not had any transplant. Not a single hair from the back of my scalp has been extracted till date. Now let's talk about which treatment would be perfect for whom. Now for example, if you do not have access to any clinic, if you're living in a very remote area, definitely traveling all the way to just get a PRP or a GFC might be an hassle. In that case, you can definitely start with Minoxidil. Just make sure not to stop it immediately after 2 or 3 months when you start seeing good visible results. Just ensure you use about 1 ml every night, apply it to your scalp, massage it and leave it on overnight to be washed the next morning. Over a period of time, within a span of a month or 1.5 months, you will start seeing visible differences. Please ensure to continue it for a prolonged period of time. Keep a target of at least 8 to 12 months. In the meanwhile, if you notice increase in your heart rate or increase in your blood pressure or any other difficulties soon after starting Minoxidil, please stop it and do consult a doctor. If you have access to an aesthetic clinic, to a dermatologist or a plastic surgeon nearby, then please do visit them. Now, between PRP and GFC, which one should you choose? Now, PRP is slightly more economical when compared to GFC. A 20 ml of blood drawn for a GFC session might cost you somewhere about 8 to 10,000 rupees depending on the clinic and the locality. Whereas a PRP should cost you anywhere between 2,000 to 4,000 rupees per session. That's what is the approximate price range in the market today. So if you're someone who's looking for a more economical treatment, go ahead with PRP. If you can afford GFC, then there is no questions asked straight away. All you have to choose is GFC and you will appreciate the results that you achieve with GFC. Now, I am a hair loss patient by myself. If you ask me what is my favorite treatment or what would I recommend to anyone who is considering to stop their hair loss, I'm always going to stick with GFC. The most effective, requires lesser sessions, and the best part, there is no side effects and can be performed for as long as you want to save your hair. Now, real results do not come from random bottles. They come from treatments backed by science. Always consult your doctor. If you are facing hair loss and you want to get your hair loss sorted, feel free to connect with us on the below mentioned number. We'll help you with your hair loss problem. So that's the primary difference between Minoxidil, PRP and GFC. Now, if you have any questions, don't forget to leave your questions on the comment section. I will get back to you. And if you'd like me to make a video on any other topic related to hair, skin, lasers or plastic surgery, feel free to leave a comment on this video and I will try to make that video as soon as possible for you. My name is Navin Koushik. You're watching my show, Let's Talk Aesthetics.